Welcome back to The Proof, where we explore science and strategies to optimize health, performance, and longevity. Today, we're diving into the fascinating world of eye health with Dr. Joseph Allen, a brilliant optometrist and the creator of Dr. Eye Health, a YouTube channel with over 1 million subscribers that is dedicated to helping people explore eye health through the lens of science. In this episode, we're covering a range of topics to help you understand and care for your vision, including the best lifestyle and dietary habits for healthy eyes, including the roles of nutrients like lutein, zeaxanthin, and omega-3s, myopia, what causes it, why it worsens, and how to reduce your risk, tips for parents to help their children achieve and maintain optimal eye health as they age, how screen time and UV exposure impacts our eyes, and practical tips to protect them, the surprising connection between vision loss and brain health, including dementia risk, and plenty more. Whether you are curious about preventing common issues or optimizing your vision for the future, this episode is packed with actionable insights. One quick note before we dive in. One thing we discussed during this episode is the importance of the omega-3 fat DHA in the eye. Dr. Allen talks about research that he's seen that suggests DHA in the eye is in a unique form that's found in animal foods like krill. We also discuss whether or not the omega-3 index, something that we can measure with a blood test, correlates with the level of DHA found in the eye. I've not been able to find any decent data on either of these things, which certainly doesn't mean it doesn't exist, but it's something that I've added to my list to take a deeper look into. I suspect that if you increase your omega-3 index to 8 to 12% with algae or fish oil, as I've done with about 1.5 grams of algal oil per day, that this would also increase DHA levels in the eye. But for now, that is me speculating, and I'll report back with a more convincing position when I have more information. Please enjoy the episode, and may your holidays be full of happiness, health, and plenty of dad jokes. Why don't we start off here kind of introducing you to the community here. You're an optometrist, but let's start with where that kind of personal interest came from. Why optometry?
So when I was a kid, I had a high prescription. I was a kid with thick, nerdy glasses, right? I was very much an indoors kid, watched a lot of movies, played video games, read books. And when I got into junior high, my mother really encouraged me. She's like, Joe, you have to get out of the house. I want you to pick a sport. And I did kind of like the manly thing, right? I'm turning 13, I'm going to play football. And it's hard to play football, like tackle football, with glasses on because they can fall off, they could get damaged, someone could get hurt. So my mother, who had worn contact lenses for years, she brought me to the eye doctor. I got fit in contacts, and it changed my life. Not only was I able to play sports, but playing sports helped me make friends. And that was a huge moment in my life where my self-confidence boosted. And with that, girls started paying attention to me, right? In junior high, 13-year-old kid, that's like the most important thing in the world. So when I would see my dentist, I didn't like it because they'd make my gums bleed and whatnot. But if I saw the eye doctor, I'm like, this is like black magic. This is amazing. They can instantly make my vision better. And just every part about it, I thought that was great. So as I got older and everyone's like, hey, what are you going to go to college for? I didn't fully know, but I knew that I liked my eye doctor and I thought maybe I could be that guy. And then finally, when I decided, okay, in the US, you have two tracks. You can either go optometry, which is more of clinical eye care, or you can go the route of ophthalmology, which is more surgical tertiary care. And I shadowed both. And when I went to see the ophthalmologist, cataract surgery, pretty easy to follow through, no problems with it. There's no blood really involved with cataract surgery. But then I did see a pediatric surgery where they did a strabismus surgery where they cut on the eye muscles. And seeing blood, my body, I learned very quickly in the OR, I don't do that well with blood and guts. So I more or less almost passed out there in the OR. And so I learned a good lesson that perhaps being the surgeon is not my pathway. So I decided, no, I'm going to stick with the clinical side of things. And so I went to optometry school. And that required 4 years of pre-med in undergraduate college and then another 4 years in optometry. And then I did a residency in ocular disease from the VA Medical Center in Minneapolis.
And today, I alluded to the fact that you have this kind of hugely engaged audience on YouTube. I think over 1 million subscribers at this point. Are you splitting time between online education and clinical, or is it more drifted towards the online education piece?
Yeah, thank you. It has drifted more toward the online education piece. I started the YouTube channel in 2018 really just to provide public education on eye care knowledge, whether it be diseases, treatments, different vision correction, whether it be glasses, contacts, surgeries, just as a resource, because I wanted people to know about this and better understand it. Because a lot of times you go to see your eye doctor, you only get like 5 to 15 minutes with them, and you leave, you're like, all my questions weren't answered. So I try to make those answers available. And over time, I'm like, this is an amazing lifestyle. This is something I'm very passionate about, and I've developed a skill set for. So I still see patients in the clinic about 1 day a week, but I spend the rest of the week, basically 7 days a week, planning and developing content for social media and YouTube.
And kind of take me into this area of science and health online. So my world is, when we were speaking about this, off air just before, but my world is more nutrition focused. And a large part of what I do is often tackling myths and misinformation and just trying to clear some confusion and help people understand why they might come across what appears to be conflicting information, but is actually explainable when you kind of break things down and consider context. Is the kind of online world of eye health similar? Are you constantly, being frustrated by coming across misinformation and myths?
Yeah, absolutely. I think every part of healthcare probably has some level of this. The eyes are very complex. They're a very complex organ, and understanding its relationship to how somebody sees and the very individualistic, like your left eye is different than your right eye. And the muscles and how they work are different in each eye, even though they work in synchronous with each other. But then there's also the brain component. A vast majority of your eyesight is not just because of the optical components of your eyeball. It has to do with how your brain has learned to see the world. And there's just a lot of people in different areas on the internet, even in other healthcare specialties, who kind of step into the realm of eye care and they misinterpret research and they try to explain things that, if they understood the basic physiology of how the eye works, they probably wouldn't make this misconnect, but there's a lot. So I do spend quite a bit of time trying to debunk these and even trying to design better videos, better narratives to help better explain, whether through analogies or something, or even self-tests to try and explain some of these things.
I'm sure we'll hit on some of these as we kind of progress through this conversation, or at least I hope we do. High level, you kind of just alluded to the kind of complexity of eyes and vision. How do our eyes work? How are we, able to kind of see the things that are in front of us? How are we able to read text? How are we able to, look out to the horizon and understand where we are? What's going on there?
So at this very fundamental component, right, you have the eyeballs in the front, and the eyeballs are the only internal organ that's on the outside of your body. Light, of course, everything around us has light bouncing off of it. It enters in through the eye. It has to pass through first your tear film of the tears that are covering the surface of the eye, the water. It has to pass through the cornea, which is like the clear window to the eye. It then gets funneled through the pupil, right? You have the iris, the colored part of the eye, the pupil. It has to then pass through the lens. Inside the eye, you have what's called a crystalline lens. And the lens is flexible. It's kind of like a pair of glasses, but it's able to adjust and change shape, which helps you focus at different focal lengths, whether you want to look in the distance, up close. And then that light has to be focused onto the neurosensory tissue in the back of the eye called the retina. When the light gets focused on the photoreceptors in that retina, then they send signals that get sent down the optic nerve through the back of the eye into your brain, and then they reach different areas of the brain, mostly in the back part of the visual cortex, which they've seen estimates of like 40 to 50% of your brain is completely dedicated to visual processing, just so that you can make sense of color, of movement, of being able to track things with your eyes in order to detect contrast, to recognize shapes, faces. We see a lot of crazy diseases where someone will have either a head or a brain injury or even an eye injury, and suddenly they can't recognize people's faces, right? They have a hard time interpreting moving objects. So there's a lot of just interesting areas of how the brain really sees the world. So it involves a lot.
Right, and if we think about the most common eye issues that people face in a country like the United States of America, what parts of that system or what parts of the anatomy or physiology are kind of most commonly affected?
So the easiest ones that people generally think of, they're like, wow, I can't see anymore, I should see the eye doctor, and then go get glasses. And most of the time, if you're wearing glasses or contact lenses, or if you need refractive surgery like LASIK, it's usually correcting for nearsightedness, or what's called myopia, which is actually when the eyeball is too strong, like the optical components are too strong relative to the size of the eye, because the eyeball can actually grow long. And then that's what we call axial elongation, and people end up being nearsighted. Because the focal, where the light is being focused inside the eye, it ends up being in front of the retina.
And that's what you discovered when you were a kid?
Mm-hmm.
Yeah, which is the same as me, actually. So when I think I was 8 years old, and this is probably quite common. I was about 8 years old, and we were driving in the car with my family, and I started to realize that my brother and my parents were able to read all these signs and billboards, and I couldn't. They were just completely blurry. And I remember saying to my mom, I'm like, hang on, I thought that was normal. I can't read any of these things. And then that led to my first trip to the optometrist.
So what you pointed out is exactly what nearsightedness is, right? You're able to see things up close just fine. You're able to look at your hand, maybe read a book, but when you look in the distance, everything is out of focus. And I think you brought up a good point that a lot of times we think our kids see just fine because we ask them, hey, can you see that? And they're like, yeah, I see that. But you don't know what the quality is, and you don't really know what they're seeing until you have like a professional evaluate it and actually measure it. So I think it's important for people who have kids or planning having kids to really pay attention to their eyesight. And we can talk about recommendations later on as well. But outside of nearsightedness, then there's hyperopia or farsightedness, which is just the opposite, right? People are able to see in the distance pretty clearly, but when they try to focus up close, whether it be their phone or read a book, they are challenged with it. And it may not be clear, or they get eye fatigue really easily, or eye strain. And so that's farsightedness. You also have astigmatism, which around 30 to 50% of everyone walking around has some small amount of astigmatism. And that's really a shape factor of the eye, usually because the surface of the eye, the cornea, is not perfectly round like a basketball. I like to describe it like a 5-year-old sat on a basketball. It kind of makes it squished, kind of like an egg shape. And that causes blur at all distances, far away and up close. And it kind of makes it like all the letters have like fuzz around it. So it's kind of hard to, people like squint their eyes trying to see a little bit sharper with it.
You can have that simultaneously having hyperopia or myopia as well, right?
Correct, yeah. You can have hyperopic astigmatism, myopic astigmatism, where it's all combined. So that's probably the most common. People have just what's called refractive error. On top of that, then we talk about more like either aging eye diseases. One of them is called presbyopia. That's where people may have great vision until they're in their 40s and 50s and they start having difficulty seeing up close, right? They have a hard time reading. So that's presbyopia, and we can talk about that. Then cataracts. Cataract development is very common. As you get older and you develop gray hair, you're also going to be developing cataracts. It's unfortunately a part of aging. That's a significant cause of blindness worldwide. Thankfully, we do have amazing surgeries to correct cataracts now. Other blinding conditions that are quite common are macular degeneration, as well as diabetic retinopathy. Those are the two biggest causes of possibly preventable blindness, especially in developed countries like here in the United States. Those are probably some of the bigger names, along with glaucoma is another one that we're always checking at every eye exam. That's where the nerve in the back of the eye slowly dies over time.
So the kind of inability to sort of read a book or a menu as someone gets to kind of age 40 or 50, you hear that classic story all the time, right? Where someone says, well, I think I need reading glasses. So that is different to hyperopia.
Yeah, it's a different mechanism. However, people with hyperopia or farsightedness tend to experience problems with presbyopia sooner. Because most people who have farsightedness, they maybe don't require glasses all the time. Some people do, but we have muscles inside of our eye called the ciliary body. And the ciliary body is a smooth muscle and contracts and allows for that crystalline lens I talked about earlier that's flexible to change shape and change your focus. So most people who are farsighted and don't require glasses, they're actually using that muscle and flexing that muscle all day long to maintain clear vision. The problem is that when you start developing presbyopia, which is Latin for old eyes, the lens inside of the eye that the muscle is pulling on, the lens starts to crystallize and harden. It's like going from a flexible jelly bean to being like a hard glass marble. So even though your muscle is still working in older age, over the age of 40, 50, your muscle's still moving, the lens doesn't want to cooperate anymore. And so you lose the ability to flex and focus on something up close.
And what percentage of adults develop presbyopia?
I mean, technically the change that's going on within the lens is happening to everybody. From age 11, you start having this algorithmically, we've developed algorithms to predict how this change in the lens occurs, and it's consistent for everybody. So there are some scenarios where people are a little bit nearsighted and they get into their 40s and 50s and they feel like, I don't need reading glasses. They maybe won't need reading glasses because they're slightly nearsighted or their pupil's really small, but the lens inside their eye is still technically changing and becoming hard. So they're still going through that process.
So it's a part of aging, essentially. Evolution, I guess, didn't really care so much about how good our vision was when we were 50 or 60.
Well, we probably weren't expected to live that long, right? So they know as far as like the process of the lens getting harder has to do with the fact that the lens grows every year of life from when you're born and you're getting older. Right, there's that kind of myth that the world or that your body replenishes all of its cells every 7 years. Have you heard that? The lens inside the eye doesn't. The lenses that you were born with, that central nucleus part of the lens is still there now, like you and I are talking, assuming you haven't had cataract surgery. And so if you look up images of it, it looks like rings on a tree. It grows thicker and thicker. There's more rings being added to it every year. And so because it's getting thicker, there's also elevated amount of pressure within the lens. And as the pressure goes up, there's a higher risk for not only the crystals in the lens to change, but then oxidation rates speed up too. And so that's why you start having not only in your 40s, the development of this lens having presbyopia, but then if you live longer, you get into your 60s, 70s, 80s, the lens starts to cloud up and becomes white or yellow. And if you let it sit there long enough, it can even become a dark brown color like coffee. But when it becomes cloudy, we call that having a cataract. And people can't see through that yellowing opaque lens anymore. And then they need something like cataract surgery.
Okay, let's let's perhaps try and step through some of these different eye conditions as they may occur through someone's lifetime.
Sure.
Would it be accurate to say that myopia and hyperopia, are they usually things that people discover early in life, or can they be late onset as well?
It can be late onset. We do have a rise in myopia right now, worldwide, which is called like the myopia epidemic or myopia pandemic. Some people will label it that. We are seeing a higher rate of children developing nearsightedness earlier in life. And when they develop it, they also tend to progress in it, becoming more and more nearsighted quite fast. And that has to do with a lot of just our societal changes. We're spending more time indoors. Our push for higher levels of education is much greater. So there's a lot, and urbanization. Our cities are getting bigger and more crowded. So there's a lot that kind of fall into that.
So if you are spending more time kind of reading or looking at a screen and not spending as much time outside looking at kind of long distances, is that you just see that naturally this kind of trade-off? Do you get better at looking at things close up, and as a result the sacrifice is, or to the detriment is, that you lose that longer vision? Am I thinking about that right?
Yeah, there is a strong association between near work and indoor time with the development of myopia, especially for young children. By the time we're all into our later, early 20s, like late teens, early 20s, then this process of nearsightedness development slows down. There are still people who develop a little bit more. Like if you go to higher rates of education, people who they go to college, they get a postdoctorate degree, they're more likely to develop some level of nearsightedness. It's not as great of a degree as young kids like age of 6 to 10 are going to have, but there still is this slow creep in nearsightedness. And then some people, about 10% of the population, still progress even past that. We don't fully understand why. There may be more genetic predisposition.
Yeah, I think for me, my prescription started off, I think, at about -3 in both eyes. It was like a glasses prescription. And I moved to contact lens when I started high school. So similar kind of story, I guess. And then my prescription was getting worse until I was in my mid-20s, and then it kind of stabilized at now it's at -5.5 and hasn't changed for 15 years or something.
You and I could probably switch, trade off glasses, and we'd probably see about the same. Right. We're pretty close.
Yeah, funny stories from my girlfriend now. We have the exact same prescription, and that's how we worked that out. I put her glasses on one day and I was like, hey, hang on, this is perfect.
I was going to say the one thing that you might want to know is for people who are nearsighted, like you and I are pretty moderate. And when you hit about -6, that's the teetering point into more advanced or severe myopia. And your rate of eye diseases or risk for various eye diseases goes up dramatically. Major ones to be always checking with your eye doctor about would include glaucoma, risk of cataracts goes up, eye floaters and retinal detachments goes up, and even having what's called myopic maculopathy as you get older, which is kind of like a cousin to macular degeneration. It can result in reduced vision and even blindness for some people. And those rates, so like when you hit the -6, your rate of having myopic maculopathy is around 41 times greater than somebody who is just no need for glasses. But if you go up to -9, so people who are really nearsighted, then they have over 130 times the greater risk of developing that condition. It's not logarithmic, but it escalates very quickly. So there's a lot of concerns about it.
Is that different if you correct the vision? So if you correct the vision with contact lens versus, say, doing surgery, are those risks the same?
Yeah, the surgery technically doesn't change the elongation, because the problem with myopia is that the eyeball actually grows longer, right? 1 millimeter of length growing in the eye equals 3 diopters. So when you were a 3 diopters, your eyeball is already 1 millimeter longer. And then now you're close to 2 millimeters. So the eyeball stretching backward in toward the brain actually causes these changes that pathologically can have consequences. And even if somebody gets LASIK, that changes the surface of the eye, the cornea, but it doesn't change the elongation of the eye.
So what are the most important parts of someone's lifestyle, would you say, perhaps that has myopia like you or I and would like to avoid some of these complications? Or maybe they don't have myopia, but they're just interested in promoting good eye health and maintaining good eye health in general. What would you say are the kind of most important things that people should be thinking about?
For myopia specifically, it's spending more time outdoors. In research right now, it's not 100% understood, but somewhere around 2 hours a day outside is recommended. This is based on a few studies, mostly done in Asia, where they find that kids who haven't developed nearsightedness yet, if they spend at least 2 hours a day outside, it offsets the progression or the development of myopia. And they found this even in college-age students as well. So I do try to encourage spend 2 hours a day outside, hopefully during daytime. They don't know if vitamin D production and sunlight exposure is directly related, but that is at least one component of the theories that are out there in the publications. The other component is trying to pull some of your near devices away. So, sitting with your phone 3-4 inches away from your face, try to push that back. And then...
or maybe switching to an audiobook.
Or switching to an audiobook, something like that. Yeah, taking more frequent breaks away from digital devices. Research comparing digital devices versus paper books, there's really no significant difference in terms of its effect on myopia progression. But there's probably the best things you can do is just get away from being indoors all day, get outside, maybe not spend all day with something directly in front of your face. Try to keep things pushed away.
I remember I had a visit to the optometrist once. I was probably in my mid-20s, and it was summer in Australia. And I remember her saying to me, do you spend a lot of time outside? Your eyes look like they're sunburnt. Is there any potential for kind of damage to the eye if you're outside for too long? Should we be wearing sunglasses? Is that a myth? And if we are wearing sunglasses, is there any type of lens that we want to be thinking about?
Yeah, no, this is great. I'm glad you brought this up. So just as you can get sunburn on your skin, right? UV light does also cause damage to the surface of the eye. First, UV light, the eyelid skin around the eyes there is the thinnest in the body. So we actually see a pretty high level of basal cell carcinoma on the lower eyelids. So that is another reason to be wearing sunlight protection. The eyeball itself can develop sun damage and sunburn. You can have what's called photokeratitis, which you can get from being outside, just in direct sunlight. In fact, if you remember last year here in the US, we had the solar eclipse. And there was kind of this social media joke that was going around a few days afterward, because there was first this huge push in when is the eclipse? Where is it going to be? How can you view it? And then the next few days afterward, the most number one searched term was, why do my eyes hurt? And that was because everybody was staring at the sun and getting this massive dose of UV light radiation. So that can cause a burn to the surface of the eye. Same thing for people who do welding as a profession. They probably know it because they get a flash burn on the eye, and that's just from the massive amount of UV that hits them in the eye. That also strongly leads to redness of the eye in two forms. There's one called a pinguecula, which is like a callus that builds in the white part of the eye. And then you can get a pterygium, which people who live more close to the equator, people who spend a lot of time near the ocean, or surfers, that some people, it is referred to as surfer's eye. And that's actually a growth that grows onto the eye because of UV light damage and inflammation that develops. And it's like this extra growth growing from the white part of the eye, trying to cover the eye to try and protect it from all of the external environmental damage.
And how might that affect someone's vision? Like, what would that present as?
Yeah, if somebody has, like a pinguecula doesn't really affect the vision other than the eye being red and irritated. When a pterygium gets bad enough, it can change it's like a scar forming, and it can change and pull on the curve of the eye and induce higher levels of astigmatism. And so that's a potential risk. And then people's vision would go fuzzy, of course. They wouldn't be able to correct for it even with glasses in some situations.
Are those conditions treatable? So once you have them, can you kind of can you reverse the condition or get some regression?
Yeah, the only way to really get rid of it is to treat it with surgery. So we can surgically remove the scar that's being formed. Unfortunately, the risk of it reoccurring is much higher, and some patients are put on special medications basically forever afterward to reduce inflammation and reduce its reoccurrence. UV light also plays a small role in cataract development too. There's plenty of research that have shown that UV light can cause a certain type of cataract called a cortical cataract. And from a doctor's perspective, if you could look inside the eye, the cataract would look like bicycle spokes coming in from every direction. And we often tend to see this more in people's left eye, at least here in the United States, because we drive on the left side of the car. And your driver's windshield has UV light protection built into it, but your driver's side windshield does not. And so people who drive like professionally, they're driving trucks and whatnot, and if they don't wear sunglasses all the time, that left side of the body, they tend to have more UV light damage on their skin, but also they can develop cataracts a little bit faster on that left side.
So do you wear sunglasses when you're outside, and is that kind of something that you would wear all the time or only at certain times of the day?
Yeah, so wearing the best practice to reduce this UV light exposure is, of course, hats and sunglasses, right? Sunglasses, I try to wear them at least between the high UV, if it's a high UV index of a day, I'll try to wear it most of the day, but the peak times are usually between 10 and 4 p.m. Otherwise, a hat can reduce the UV light exposure by about 30%. It's not 100% because sunlight is also bouncing off the road. If you're by water, it bounces 100% off the water, and then you get it from underneath too. So you get kind of a double whammy if you're on the ocean. So as far as sunglasses go, if you're buying super cheap sunglasses, you have to be worried a little bit about the lens having full UV light protection. Most sunglasses, though, that are sold on the market, especially here in the US, that they're even of decent quality, should say 100% UV light protection on it, either on the tag or on the side of the frame. Or they're made of a safety material plastic called polycarbonate, which inherently has close to 100% UV light protection.
Yeah, it's a good point that you make about the light bouncing off water or off the ground, because it's very easy to go about your day walking around outside. Maybe you're not looking directly at the sun, so you think, my eyes aren't getting direct sun exposure, but from what I hear you're saying here is that they're still getting exposure to these UV rays.
Yeah.
My go-to brand for all things protein and creatine is Momentous. To help reach my daily protein target, I complement my diet with 1.5 scoops of Momentous's chocolate or vanilla chai plant-based protein for 30 grams of protein and all essential amino acids, which supports muscle growth, hormone and collagen production, skin health, and recovery. I also consume 10 grams of Momentous's creatine daily to enhance energy production, muscle strength, bone health, and cognition, with studies now showing the benefit of creatine on short-term memory and intelligence. I'll do anything for a little extra brain power. Both products are NSF certified for sport. This certification is the only third-party certification program trusted by the NBA, MLB, Ironman, etc. NSF certification means you can rest easy knowing you're actually getting what's on the label and nothing more. So if you're interested in making a true investment in your health, why not join the best in human performance and be a part of the change in raising the bar on supplements? Simply go to livemomentous.com and use the code LIVINGPROOF for 20% off your new routine today. That's livemomentous.com with the code LIVINGPROOF. The other glasses that have become very popular are blue light blocking glasses. I'm sure you've probably covered these in some sort of video on your channel. Are blue light blocking glasses, are they effective in kind of protecting our eyes in any way? I know that most companies that are selling them are kind of promoting them as a way of kind of nurturing your circadian rhythms so you can fall asleep better and get a better quality sleep that night. Is there any research looking at how blue blocking glasses, say worn at night, for example, when using bright screens, affects the eye?
Yeah, so there's a lot in the blue light glasses, or just blue light, we can discuss here. Just to answer your question immediately, there is some evidence that wearing the darker orange, even kind of moderately red lenses, they can shift the amount of melatonin that is being produced. However, if you really ask the PhD researchers who are doing this research, as I have, because I'm friends with some of them, they don't wear them. they severely, like, yes, it has this effect, but how much? And how much of effect are you really getting on your circadian rhythm because of the light versus everything else that's affecting your sleep cycle? Like the fact that you're being stimulated at night, not by just the blue light on your phone, but because you're surfing through social media, or you have something else like music and things like that that are stimulating your brain to keep you awake. So I can talk about that a little bit more, because that is one area where probably the most research to support the use of blue light glasses is the fact that the darker ones can shift have an effect on your melatonin production. But the whole concept of blue light and the concerns about blue light have been in the eye care industry even since like the 80s and 90s. This is not like a new thing. And this is because it actually is tied to somewhat of that UV light discussion we had. We know from epidemiological studies that people who are on the ocean, who like fishermen, people who don't wear sunglasses or UV light protection, they are at higher risk of developing aging eye diseases, not just cataracts, but also macular degeneration. However, UV light doesn't penetrate and get to the back of the eye. UV light is 99% absorbed by the cornea of the eye, and the 1% that gets through is blocked by the lens. So how is there increased risk for the retina in the back of the eye? Well, high energy visible wavelength light, which is purple and blue light. We've now labeled it as HEV light. HEV light does get to the retina, because right, you can see the color blue, but that has higher energy to it, and that creates higher levels of oxidative stress and inflammation within the retinal tissue. And so that's been the theory, is like, oh, perhaps it's this high energy blue wavelength light that is indeed increasing the risk of macular degeneration. So that's been around for a long time. Now with that, especially with the development of all of our new technology and screens, there has been some concern that perhaps screens could increase this risk. However, that has not been found. It turns out that the amount of blue light you get from your digital screens is such a low power density that there's no association. There's a few publications out there that kind of theoretically are concerned, and they're looking more into it. But as of right now, there's no publicly available research that implicates domestic use of blue light from LEDs or computer screens can cause retinal damage.
Blue light blocking glasses outside.
So that there are some professionals I know who do recommend blue light glasses for their high risk patients when they step outside, but they're still questioning the effectiveness, mostly because some newer publications where people have had cataract surgery, they started, because of this theory and concern, they took the implants for cataract surgery and they turned those into blue light blocking lenses. And they implanted them. And they watched them over 15 years to see who developed macular degeneration and who didn't, versus the people who had just had the clear lenses. And they didn't find a significant difference. So there's still some question of how much blue light really plays in the risk of retinal disease.
I also have to wonder if there there might be some negative kind of adverse effects of completely blocking a lot of blue light.
Especially on our circadian rhythm, for that exact same reason as we discussed earlier. There is a cell in the retina that they only discovered about 10 years ago, about 2014, 2015, called an IPRGC. Ever heard of that?
No.
It's an intrinsically photosensitive retinal ganglion cell. And it only accounts for about 1% of our retinal tissue for photoreceptors in the retina. It doesn't give us any vision. It doesn't give us any of your ability to see. It speaks only to the superior colliculus and to other parts of our brain to really control our metabolism, but also has some influence on things like our sleep cycles. And so this specific cell in the retina is sensitive to many wavelengths of light, but it is most sensitive to blue light around that 460 to 480 nanometer mark. And so that's why these other blue light blocking glasses that are darker, the kind of a darker orange, they block out that 460 to 480 nanometer mark range, and they suppress the kind of activity or sensitivity of these cells in the retina.
What about our diet? If we're thinking about general eye health here, and perhaps we can, as we move through this, if there are any specific conditions where diet is even more important or specific nutrients are, we can kind of call them out. But broadly speaking, when someone comes to see you and just says, "Hey doc, does my diet, do the foods that I'm eating for breakfast, lunch, and dinner, are they affecting my vision?"
Simon, thank you for bringing this up, because this is obviously something that diet nutrition is something that you focus on pretty heavily and are passionate about, but it's also something I'm very interested in. The answer is yes. Your diet does change your risk for eye disease and how your eyes and vision function. The vast majority of research in the eyes specifically do indicate that eating a Mediterranean diet or an ancestral Mediterranean diet, and I say that just because, again, we want to be avoiding processed foods. We want to avoid high sugar, artificial sweeteners, these sort of things. But the Mediterranean diet, one, green leafy vegetables. I try to tell everybody, eat your greens. Even though everyone thinks carrots, right, are the food for the eyes. And carrots are good for the eyes because they have a lot of beta carotene, which your body can either convert to vitamin A in your liver or in your small intestine, and your eyes will use vitamin A for phototransduction, but also because beta carotene is a good antioxidant. However, green leafy vegetables have potentially even more benefits for the eye, and I'll go into the specific kind of nutrients of why that is. But the vast majority of research looking at aging eye diseases, cataracts and macular degeneration, they do support that people who eat more leafy greens and potentially more fatty fish at least twice a week have dramatically reduced risk of developing and progressing in those diseases. Same thing for people who have diabetes and diabetic retinopathy.
Have you ever come across the MIND diet? Have you ever seen that?
Yeah, I have come across that. There are a few publications looking at MIND diet for eye health as well.
Yeah, it was you mentioned dark leafy greens and fatty fish there, and it just reminded me of that kind of dietary pattern. And I think that was out of Rush University. They were looking more at a dietary pattern that could help reduce the risk of dementia. So also similar area of the body, brain related at least. And I know within that there was a strong emphasis on having like a daily salad and a good serving of dark leafy greens.
And it's interesting because both macular degeneration and glaucoma more or less are kind of cousins to like Alzheimer's and dementia. They are all neurosensory degenerative diseases. And there's a lot of research going into how we can diagnose and track Alzheimer's through eye exams now, which are quite fascinating.
Just quickly, while we're on that, and then I'll let you get back to the foods and dark leafy greens and nutrients. I had an episode recently with Dr. Kellyanne Nyotis, and she's a preventive neurologist. And we were talking about a new kind of committee report on preventing dementia. And it was published in The Lancet. And they came out with 14 risk factors. And they basically said if fully addressed, about 1 in 2 cases of dementia could be prevented. And it was very interesting to me to see that uncorrected vision loss was actually one of those risk factors for dementia.
I mean, I think it makes sense because of how much of your brain are you using if you can't see very well, right? You're
Right.
By having good vision, you're increasing the amount of accurate, amount of data points from just eyesight coming into your brain and feeding your brain. So if your vision starts deteriorating, you're sending poor data to the brain, and it's just not being able to use that effectively. So there's different thoughts about having good hearing, good mental, good vision, and its effects on risk for dementia and just Alzheimer's in general. Back to kind of talking about the diet component. So even in so there's again a lot of research into diet and lifestyle factors that affect the eyes. In 2024 alone, just as a kind of a recent study, because you can go further back, but even just a recent study that was published this year in the American Journal of Clinical Nutrition, they looked at the original ARED studies, the age-related eye disease studies. These are large-scale studies, thousands and thousands of people. They track them, their diet, and their blood tests every week for anywhere from 5 to 10 years, depending on which study. And they track their eyes and their vision, and they watch people develop things like macular degeneration, cataracts, etc. But they find that people who ate at least 2.7 servings of green leafy vegetables, and that's like nothing, right? 2.7 servings a week. Usually we want,
wow.
Yeah, we usually are we want that a day, if not more, but that was just a week. The people who ate 2.7 servings a week had a 25% reduction in progression of macular degeneration from going from early to advanced, which is significant. People who had oily fish in their diet at least twice a week had a not as significant, but it's about 21% reduction in their risk of progression. But there's a synergistic value. They found that people who ate both higher amounts of green leafy vegetables and the oily fish, they had a 41% reduction in progression. So it's important to understand that the retina in the back of the eye is one of the most highly metabolic tissues in the body. And so it's constantly being bombarded by light energy. And so it's a lot of oxidative stress. It's a lot of inflammatory processes because the cells in the retina have to constantly regenerate. And that ends up putting a huge tax on those tissues. And because it's neurosensory tissue, it also has a high level of omega-3, specifically DHA, types of omega-3 fatty acids. It counts somewhere between 50 and 60% of all of the lipid layers in those cells is DHA.
Do you think there is a difference, or is there any kind of evidence that you've seen that would suggest that risk reduction is from DHA itself, so it could be achieved just through supplementation, or is it perhaps that fish, is providing some benefit to eyes beyond the DHA that it contains?
So this has been an area of fascination for me, and honestly, I ate very much a plant-based lifestyle, whole food plant-based, starting in about 2016, 2017, when I started really getting into diet and understanding its effect on the eye. I only started putting in a lot more fish because I started reading the research that shows a large discrepancy between, if we look at studies where people are eating whole food sources of fish, their risk of retinal disease, both in diabetic retinopathy, macular degeneration, goes down. But people when we supplement only with omega-3 supplements, we don't see that same effect. And so there seems to be this interesting disconnect. And only until the last about 5 years or so there's at least some publications kind of hinting toward why that may be. And part of this, again, has to do with DHA. I didn't know this. I didn't learn any of this in school. I had to study this all on my own afterward. But so there's different types of DHA omega-3s. There's triacylglycerol tag DHA. There's phospholipid DHA, and then there's lysophosphatidylcholine or LPC DHA and type 3. And neural tissue, your brain and the eye, they are very similar. They have the blood-brain barrier, and then there's the blood-retinal barrier. And there's a specific transporter called an MFSD2A, and it's a process that shunts specifically the LPC or the type 3 DHA into neural tissue. And when you eat animal products, whether it be salmon doesn't really have that much phospholipid in it, but fish roe, like fish eggs, and some krill oil has higher levels of type 2 DHA, which your body can break up into type 3 and type 1. Your body still does get some DHA into the neural tissue through the kind of triacylglycerol pathway, but it has to be broken down in the liver, and it's not as efficient. And so more recent studies, at least in animal studies, I couldn't find anything in human studies to date, but in animal studies in mice, they are finding when they feed this type of type 3 DHA to the mice, their risk of diabetic retinopathy and macular degeneration and overall retinal function is much better.
That's super interesting. So type 3 DHA, what was the kind of long name for that?
Lysophosphatidylcholine.
Lysophosphatidylcholine.
Or LPC DHA.
And are there any companies, to your knowledge, that are selling that form of DHA in a supplement?
There are some supplements. If you look on krill oil develops, about 30% of krill oil has at least type 2 DHA, which again, your body can convert. So there are some companies that are selling phospholipids with the DHA, but I don't know of any companies that are just selling the type 3. Because I haven't seen any human studies in it, and so they may be in the process of testing that out. But the few companies that are doing the research, or I shouldn't say the companies, but the people doing the research, especially in Alzheimer's, they're taking krill oil and then they're basically in the laboratory pulling off the type 3 DHA, and then they're concentrating that to 100% of that specific type 3, and they're giving that to mice. That's how they're studying it for Alzheimer's. And
so if people are eating, say, like a couple serves of fatty fish a week, so there's that SMASH acronym that you've probably heard, salmon, mackerel, anchovies, sardines, and herring. I think it's herring.
I think herring's in there. I personally eat salmon or sardines.
Right. And so if someone chooses that option and they have a couple of serves a week, they're getting enough of that type 3 DHA you're referring to?
At least it's tough for me to say exactly how much of this type 2 or type 3 DHA they're getting, because there's only a few sources I could find that really break it down that detailed. The two fish sources that have the most that I've found in the research are either in krill or they actually have it in fish roe. Fish eggs has a really high level of that type of DHA. So when I go and get sushi, I try to find whatever sushi they have that has fish eggs on it. That's at least where this research is currently at. I still think we need a lot more research before we can definitively say how much does somebody need, what kind of an effect will that have. But that's where the kind of bleeding edge, cutting edge research in eye care and understanding the relationship of omega-3s to retinal health is at.
I wonder if there's any research looking at the kind of incidence of macular degeneration in vegetarians and vegans and whether that differs to omnivores. Have you seen anything that's looked at that?
Yes, there are some pretty good studies on that. They do find that the higher amount of meat consumption is at a higher risk of developing age-related eye diseases for both macular degeneration and cataract formation. They have broken it down further into like saturated fat. So saturated fat, higher intakes of that has a significant relationship to higher rates of macular degeneration. There is at least one voice in the carnivore community who strongly advocates that macular degeneration is caused by seed oils. However, again, large-scale published studies have actually shown that linoleic acid is only nominally very weakly associated with macular degeneration. So it's kind of interesting to see some voices and I'll say hypotheses that come out in that area. But right now, the vast majority of the research does suggest diets that are more rich in vegetables, whole foods, and some moderate amounts of oily fish are more protective for retinal function and eye health.
What would your advice be for someone who is consuming a sort of plant-rich diet, but for whatever reason doesn't want to eat seafood? What would your supplementation advice be for that person?
Of course, there is alternative sources for omega-3s. There are algal oils. There are studies, people taking like flaxseed oil supplements. I think I'd probably go the route of algal oil. I've even did my own self-study on that for several months. And I did have, it took me like 6 months of not having to take any omega-3 supplements just to get back to baseline. Because I actually went through a full self-study for several months, taking omega-3 supplements, the fish oils, watching my omega-3 index. I would take I'd get my index run by Omega Quant. I have no relationship to that company, but I would do my blood test through that, follow my numbers. And I went from when I first started, it was just mostly plant-based. And I was getting around 4.3% in my omega-3 index. Taking fish oils, I went all the way up to 9 something within just a few months. Then I went 6 months without eating any fish oils, but still eating some oily fish, and I was down to like 5 something. And then I took algal oil, and it went up to like 7. It didn't go up to 9 of what I got with the fish oil, but it got up to like 7. So it did have an effect.
Do you recall what dose of algal oil you were taking?
I was taking like 2,000 milligrams a day. And I was doing this, it's a lot. I was taking that specifically for dry eye. And there's a lot of research in omega-3 benefits for dry eyes, but it's very inconsistent and all over the place. There's a lot of debates in the eye care field about the effectiveness of omega-3s for dry eye specifically. But there are a lot of eye doctors in the dry eye space who recommend somewhere in a higher dose of 2,000 to 3,000 milligrams a day for omega-3. But it's tough to say exactly if that's that effective or not. Anecdotally, I had success in it, but dry eye is a very complex disease. And we can do a whole hour-and-a-half podcast on just dry eye.
Yeah, I'm going to make a note, and let's maybe come back to that, because I kind of put out to the community that there would be this episode on eye health, and a number of people were asking about dry eyes, particularly people that are sort of post-surgery. Interesting your experience with DHA supplementation and using Omega Quant, because I did a similar experiment, and I can tell you, eating plant-based and not supplementing with DHA EPA, my baseline result was like 4.5%, I think. And I ran a similar experiment to you. I think I responded a little bit differently. It sounds like I think I did around 1.5 grams of DHA EPA, and it was algal oil, and my omega-3 index went up to around 9.5%. So obviously there's going to be a little bit of variability between people, but using a company like Omega Quant, which I'm also not associated with, is not a bad way of trying to determine what dose is kind of best for you.
Mm-hmm. And so I'll talk with patients who, if they're interested in taking omega-3s as a supplement. I know a lot of doctors who would be like, yeah, start taking this. And I'm like, well, you're not really measuring a baseline. Like, what's their diet at? So I do recommend, and even some clinics I know, they just sell the Omega Quant directly to the patient from the clinic right there. So they can just take that, send it out, and then they know what their baseline is. or if they are taking supplements and not sure how good or if that's the right dosage for them, then they can start to make those alterations. But you have to have a measurement to know really where you're going to go.
I guess now something that I'm interested in that you've brought to my attention with this kind of type 3 DHA is whether omega-3 index, which is looking at omega-3 content of red blood cells, whether that actually correlates to DHA content in the eye.
It's a good question. I'm not entirely sure. I know there was just a publication this month going into that did find it was a study using Mendelian randomization analysis, and they had over 250,000 people that they analyzed over 13 years. And they watched people who didn't have any retinal disease. They saw how many people developed macular degeneration. And they found that for every millimole per liter increase in the omega-3 and DHA, they looked at both. They found, and they didn't specifically say DHA type 3, they didn't break it down into that detail, but they did find about a 25% increase of reduced risk of macular degeneration for people per millimole per liter in their blood with omega-3s. But then there was like a 30 to 35% reduced risk for people with higher levels of DHA. So there is an association. Of course, there are conclusions that we need more studies, specifically clinical studies. But it's still the data largely points that yes, this is a positive benefit.
And this is, of course, pretty much important for everyone because the average person in the general public is not eating 2 serves of fatty fish a week, and people who are adopting vegetarian or vegan diets, many of them are probably not supplementing with DHA, EPA, and generally the research that I've seen looking at those populations suggests that if they're not supplementing and you're not eating fatty fish, you probably will have an omega-3 index around 4%.
Yeah, somewhere around 3 to 4% is what I've heard as well. And that's been my anecdotal experience, and it sounds like yours too. But yeah, I only started making that change maybe 2 years ago after I really started digging more into specifically what's going on pathophysiologically in the eye and what is the data showing. But I still prioritize lots of vegetables and fruits and vegetables and whole foods.
Right, I want to come back to dark leafy greens and perhaps what's going on there at a nutrient level. But just quickly, you mentioned saturated fat associates with increased risk of some of these age-related eye diseases. Is that thought to be related to kind of arterial health and atherosclerosis or risk of atherosclerosis?
So 100%. The back of the eye is incredibly vascular. You have a dual blood supply in the retina, both blood vessels within the retina itself, and then you have blood vessels behind the retina in what's called the choroid. And these vessels are incredibly small. They're so tiny that if somebody has plaque that has been dislodged from like their carotid arteries, we will see those plaques stuck in the retina itself. We call them Hollenhorst plaques. And you can look up images online. You'll see these cholesterol pieces stuck in the arteries. And that's essentially a stroke. When we see that now, we immediately see somebody, you have this, we're sending you to the stroke unit right away, because we don't know if that's going to dislodge and cause more a cerebral vascular accident or what. So whether it be diabetes, whether that be from macular degeneration, because there's a lot of blood flow and lack of nutrients and higher levels of essentially oxidized fat that's depositing in the retina or weakening structures of the back part of the retina. It's all very tightly related. And so many cases of blinding eye diseases I'll have are people who have, again, either problems with blood flow to the eye from diabetes or macular degeneration as they get older, or even having some sort of vascular stroke of the eye. And in young people, it's more hypercoagulable states, right? They'll have like factor V Leiden or some sort of blood issue. But with older individuals, it's always related to cardiovascular disease.
Right, which then kind of just speaks to an overall lifestyle that's conducive to healthy cardiovascular system, which people are on this show are pretty familiar with. Diet, lots of exercise, consistently.
Right. And there's some effect on stress levels too. There's some interesting research on looking at stress biomarkers and their levels to eye pressure and risk of glaucoma progression. There's some interesting studies in that too. So I do encourage people, if they ever tried meditation or yoga, those sort of things, that may have an effect on lowering your stress system, and that may have a positive effect on the eyes.
Yeah, I had a researcher on the show last year talking about the positive correlation between having good relationships in your life and longevity. And one of the proposed mechanisms is that having these good social connections, and it's not quantity, it's quality, is a really good way for attenuating stress in your life, having people that you can talk to about what's going on in your life. So, that's another kind of tool to throw into that stress equation.
So another interesting component that kind of goes back to this cardiovascular disease, which ties into the green leafy vegetable discussion that we were having. So one of the reasons why eating green leafy vegetables is so good for the eyes is because they have high quantities of carotenoids that are known as lutein and zeaxanthin. And I know you recently had another guest on that was talking about carotenoids and their benefit for the skin. And that's true, but there's specific carotenoids, lutein and zeaxanthin. These, of the 600 plus carotenoids in nature, only these two go to the eye. And they deposit in extremely high concentrations in the retina, and the concentration increases the closer it gets to the central macula, which is like the bullseye of the eye that you use for seeing 20/20, that you use for color vision, sharp acuity. And they have three functions in the retina. They first filter, they're actually yellow, kind of orange colored pigments, and they filter out high energy light, like blue wavelengths of light. So they have this built-in shield to protect the delicate tissue. They then have antioxidant. They're a very potent antioxidant, carotenoids. And then you have an anti-inflammatory effect that they all are protecting and helping support that area of the eye. And the higher amounts of this that you ingest, you can increase the amount of pigment in the retina. And we can measure that in the eye clinic through a couple of ways. But most commonly is through what's called MPOD testing, or macular pigment optical density testing. And people who have higher levels of this pigment have about 30 to 40% reduced risk of aging eye diseases. So there's a strong relationship. The place where it connects these carotenoids, lutein, zeaxanthin, to cardiovascular disease is a recent publication this year. One of my good friends, Professor Dr. John Nolan, he's out of Ireland. He does his PhD and all of his research primarily on these type of carotenoids, either in supplementation or through diet. And they did theirs this year looking specifically and finding it reduces inflammatory signals in your arterioles, in your vascular system. So it actually shuts down tumor necrosis factor alpha, helps reduce interleukin-1 beta, and then reduces oxidative LDL.
Oh, wow.
Yeah, like it's really cool some research. And I'll be able to provide you with a bunch of these different articles in case you or your anybody listening wants to really nerd out on it.
Well, yeah, that might come as a surprise to some of my carnivore friends who like to claim that dark leafy greens are poisoning you, but at the same time claim that it's all about ox-LDL, and that's the problem. So
yeah,
that might be hard for them to reconcile.
Yeah, but I'll send it because it's a really interesting article. Of course, a lot of people who, if people do want to try and get lutein in their diet by not eating vegetables, really the only good source is in eggs, primarily the yolk of the egg. That's kind of an interesting thing because I even learned that in school. But the amount that you get in the yolk of the egg is only about 0.2, it's like 200 micrograms. It's really not significant. It does have a greater bioavailability because it has, carotenoids are lipid soluble.
Right, so it comes with some fat.
So it comes with some fat, but 200 micrograms is not enough to make a strong, significant difference unless somebody is extremely deficient in lutein and zeaxanthin.
What kind of dose does the evidence suggest per day is kind of effective when it comes to lutein and zeaxanthin?
Yeah, so the optimal amount is somewhere between 10 and 20 milligrams of lutein a day and 2 to 4 milligrams of zeaxanthin. And they
what does
usually
that
come
look
hand in
like
hand.
from a food point of view?
So I've dug into this, trying to better understand how much is in like kale. And sources are a little bit all over the place. If you're eating raw kale, I've seen some sources say 16 milligrams in 1 cup of raw kale. And then I've seen some sources say higher, up to like 35. So I've seen some discrepancies, but you do get quite a bit. But again, bioavailability is a question of that. And so you do need to have some level of oil, whether that be, salad oil, olive oil on your salad dressing. I'll eat handfuls of walnuts or pistachios. Pistachios have a little bit of lutein in them. And funny enough, the egg yolk, the reason why chicken eggs even have lutein in them is because they supplement lutein in chicken feed.
Wow.
They put it in there as a supplement because it makes the egg yolk look more bright yellow and orange, which is part of their marketing because it looks better. And people are more likely to buy and enjoy their eggs if it looks pretty.
And which foods contain zeaxanthin, and how would you get 2 to 4 milligrams of that per day?
Yeah, so pretty similar. It's in a lot of just various green leafy vegetables. Some peppers will have it. I've seen one lecture by another eye doctor who put up that there was a decent amount of zeaxanthin in goji berries, but I wasn't able ever, I tried to find this publication myself and I could never find it. So next time I get a chance to speak with that retina doctor, I'm gonna have to ask him where his sources are at, but there may be some in goji berries, maybe.
Right. And is kale the kind of the superstar when it comes to these carotenoids over and above, say, rocket or arugula? It's called in America.
The darker leafy greens, yeah, spinach, kale, they're all kind of up there. Spinach is pretty high too, like 12 milligrams per like 1 cup. So there are patients I've had, we've done macular pigment testing, and they're not taking any supplementation of lutein or zeaxanthin, but they've been eating like a whole food plant-based lifestyle for several years. And they'll come in and we'll do testing, and I'm like, wow, your scores are way above average. To give frame of reference, in the United States, average is like 0.3 on that test. It's out of 1. So they're at like 30%, and that's bad. You want at least a 0.5. And so the few times I've had people come in who are either taking supplements or they have a diet that's rich in vegetables, they'll sometimes be in the 0.6, 0.7 range, which is really, really good.
And that test is something that you can do with any optometrist?
Not every clinic's going to have it. Some clinics do, some clinics don't. So it's something you might have to ask around if they have it or not. There's also different brands of the testing, and they are more of a subjective test. So some brands I personally have a little bit more faith in, but yeah, it's unfortunately not something that's standardly used or available at every eye clinic.
On that topic, how often should the average person see an optometrist? Maybe that depends on whether they have an eye condition or not, but what's the starting point?
Yearly. This has been an interesting topic because there are groups in the American Optometric Association for evidence in clinical-based practice, and they even talk to other professionals outside of eye care. They take a multidisciplinary approach, and they do consistently recommend, even if you don't have a vision issue, getting your eyes evaluated every 12 months is the best option. Even the US military just came out saying they recommend yearly eye exams for people, even if their vision is fine, because detecting vision issues ahead of time has this cascade effect of improved productivity, a less chance of injury. Just there's so many kind of benefits down the road from it. Even if, hey, guess what? You don't need glasses. Your vision's doing great. See you next year. There are many cases where people come in and will be like, oh, you actually have a small bleeding spot in your retina you wouldn't feel because you don't have any pain receptors in the back. So at least every year, some people more often if they have a specific disease. But some doctors I know also will say, hey, you have perfect vision. We'll see you every 2 years. Some doctors will do that.
This episode is proudly brought to you by 38 Terra. Try 38 Terra's DMN Prebiotic, the science-based daily multivitamin for your gut microbes, a simple and delicious way to take your gut health to the next level. Now back in stock in new and improved packaging for customers living in the United States, Australia, and New Zealand. Get 10% off your DMN at 38terra.com using the code THEPROOF. That's 38terra.com and use the coupon code THEPROOF for 10% off. And coming back to diet, so outside of just eating generally a kind of unprocessed plant-rich diet, either fatty fish a couple of times a week or making sure you're supplementing with DHA, EPA, getting enough dark leafy greens in your diet so you have enough lutein and zeaxanthin. Are there any other particular food groups or nutrients that people should be thinking about?
So the two other kind of big ones, for vitamin D is a big one that's getting a little bit more attention. And I think that's partly, again, because a lot of us spend most of our time indoors now. So there is some question of vitamin D's utility in various eye diseases. I still think there needs to be a lot more research to tell us exactly how much, but I think people should be cautious and just aware of how much sunlight are they getting, or are you choosing to take a vitamin D supplement? So those are just something to be aware of. The other one is carotenoids, not carotenoids, but it still is a carotenoid, but is curcumin. So, the derivative of turmeric. They've looked at that for its anti-inflammatory and antioxidative properties for several different parts of the eye, both for dry eyes is more of a recent one that they're looking at, but then also for retinal health. And I think that the challenge with specifically with understanding like dosage when it comes to curcumin. I don't know, have you studied curcumin much, or I don't know if...
Not in a lot of detail. I mean, I understand that it can be paired with pepperine or black pepper to enhance absorption. I understand it has some anti-inflammatory properties, but not a lot in terms of dosing.
Yeah, so in the past, I used to take around 1,000 milligrams a day of curcumin that was mixed with pepperine or piperine, however you want to say it, because that helps improve the absorption in the gut. However, I found out that now they've developed nanocurcumin or microcellular curcumin, which is bioavailability is about 60 times that of regular curcuminoids with piperine. And I'm frustrated because I've consulted with some of these companies who develop these for eye care, and they don't label it. They don't have any sort of way on the bottles or to designate that this is nanocurcumin versus regular. So I questioned them. I'm like, why do you have such a low dose of curcumin in here that's not going to be clinically significant based on all these other studies? And they're like, oh, this is nanocurcumin, this is different. I'm like, well, you should label that. So there is some interesting research in that. And curcumin may be having a benefit for both the retina as well as dry eyes because of its anti-inflammatory effects.
On vitamin D, is it just the serum vitamin D level that is important? So you could, achieve that through sunlight exposure or supplementation or a combination, or is there something important about the cells within our eye synthesizing their own vitamin D from exposure to sunlight? So
this is a very interesting question. One, I'll just kind of say I personally cannot say I know enough to answer all of that question. It's something I'll have to dig deeper on. And I think from what I've read in the research on vitamin D, maybe we just don't fully know. There are cells within the eye that do produce vitamin D. However, I don't think that has very strong implications for a lot of eye health. And I kind of say that because there is kind of this myth online that sunglasses somehow hurt your eyes because you're preventing UV light from getting into the eye, and then your eye's not making its vitamin D. I don't know who started that, but it also doesn't make sense because, again, UV light doesn't get to the retina anyway. So there's a lot of curious thoughts about that.
Just on that sunglass piece and thinking about protecting our eyes, you have light eyes, I have light eyes. Are lighter eyes more vulnerable to damage from the sun? Or is that a myth?
There are some older epidemiological studies that do show an association there, but more recent studies do not show that eye color makes a strong increased risk of like retinal disease. What is associated with it, obviously, is if you're, who likely has lighter colored eyes? Caucasians have lighter colored eyes. People with lighter skin tones. People with lighter skin tones also tend to have lighter colored retina in the back. And so with that, they may be not absorbing as much of the high energy light, and they maybe are having higher exposures of the high intensity light, which may be contributing to oxidative stress and inflammation. So there may be an association there, but eye color alone, they have not found strong associations.
I want to come back to myopia, but just quickly while we were on kind of lifestyle preventive things that people could do to promote good eye health and hopefully prevent some of these age-related conditions, or at least push them back. I'm assuming that a lot of the risk factors for other kind of chronic conditions are shared. So high blood pressure, high blood glucose, with elevations in blood cholesterol, all of these things are likely associated with these eye conditions.
Yeah, very much so. I mean, a big thing of a lot of research and my education as an eye doctor is focusing on effects of like diabetes in the back of the eye, because diabetes, if there's elevated blood glucose over long enough time, this causes damage to the blood vessels, the arterioles within the retina. And then we start seeing microaneurysms, where we see an outpouching of the blood vessels, eventually breakage and bleeding into the eye. This also, if they have elevated sugars for a long time, blood glucose, this can cause the lens inside the eye to swell and develop cataracts faster. There's many downstream effects, and it's all tied to lifestyles that have high levels of, I can't say just dietary cholesterol, but high levels of saturated fat, high levels of glucose in the blood, sedentary lifestyles. They're not getting enough exercise. They're all very much connected.
Once someone has myopia like you or I, is there any way kind of outside of surgery to correct your vision? Could I go from a minus 5.5 back to a minus 3 by doing some specific eye exercises, for example? And I know that you're kind of laughing as I say this. I did a very quick skim online, which I know is naughty, but I thought, you know what, I want to jump on Reddit. You can find anything on Reddit. And I saw all sorts of threads of people talking about eye exercises to kind of reverse myopia. And I think the Bates method or something else came up. True or false, are there eye exercises you can do if you're someone who has nearsightedness and wants to improve your vision?
So the quick answer is no.
Damn it.
Again, like the eyes are very complex, and there's a lot of nuance in there. And I know some people, there's very loud voices online who are like, I reversed my nearsightedness by doing eye exercises or changing something in their lifestyle. Well, the reality is they probably weren't nearsighted. They probably had something called pseudomyopia, which is where you have an accommodative spasm. Again, there's a muscle inside the eye that's smooth muscle, and you can't train smooth muscle. It's not like skeletal muscle that you can buff it up. But people can have a spasm of that because they spend so much time indoors, and it kind of gets locked in. It's like you were lifting and doing bicep curls at the gym, and you got that, like, you're just doing warm-ups and you got stuck holding the 10 pound up here. So more or less, I think the people who are having those benefits, they've simply learned to finally relax and put down the weight. And suddenly they're no longer nearsighted anymore. So that's more or less how it is. They have done studies. There's plenty of research out there on using eye muscle exercises, testing the Bates method and other methods that come from the East. And nothing is conclusive. They conclude that it doesn't do anything. Like the p values are like horrible. It's not associated. And it makes sense because some people are like, oh, well, you just got to learn to relax the muscle inside the eye. It's like, I can do that pharmacologically. You come into the eye clinic, I'll put the strongest eye drops we have. You won't be able to use that muscle for a week. It'll fully relax it. And when we fully relax those muscles, people's myopia doesn't go away. So unless they're in this accommodative spasm. So I could go a lot more into it. There are some eye exercises that are used for people after having head or brain injury, or what's called orthoptic vision therapy. And there are certain muscle coordination deficits that even young kids can have where we can do these forms of vision therapy and retrain these muscles. And I should say, to be clear, you're not changing the muscle. You're changing the neural connection between the brain and those muscles and the coordination. It's kind of like doing physical therapy, right? And you're coordinating those movements and the coordination. And that can have an effect on how you use and operate your eyes. There's one other caveat where there are some studies and even some services now that do vision therapy exercises, but they're actually enhancing your cognitive perception of eyesight. So they help you improve your contrast sensitivity and your ability for visual processing speed, especially as you get older. And that can help with being able to read a little bit faster, be able to recognize shapes and objects and letters easier. But again, that's not doing eye exercises to reverse myopia. It's really improving your brain and the coordination of the brain and the eyes.
So if you have myopia or you're trying to prevent it, this comes back to what you said earlier in the episode, that one thing you can do is try and balance out the time where you're looking at things very right in front of your face with looking out to the horizon and spending time outside in nature. So is that the kind of best quote unquote exercise that someone can do?
Kind of, I'll say natural exercise. Like the one thing that you have control of all the time is that. There are some optical devices and treatments that we now have access to that it won't reverse myopia, but it'll slow down its rate of progression. And this is most important for young kids who are at risk of myopia or already developing it. Right now, what we have available are some glasses lenses that have been shown to slow down myopia progression. There are some contact lenses, both soft lenses, as well as hard lenses, such as what's called orthokeratology. Those have been shown to slow down myopia progression by up to 50%. There's some pharmacological eye drops, mainly low-dose atropine, that have been used for a long, long time, but those can also help slow down the rate of myopia. And then right now, in the cutting-edge research in both Asia and in Australia, they're doing red light therapies for children to not only help slow down myopia progression, but help even stop it from developing.
Wow.
So it's a fascinating area.
Is that very preliminary, or is there kind of strong evidence with specific protocols that have been shown to be effective?
Yeah, there's a few devices that are available in the market outside the United States, and they're basically treating for 3 minutes twice a day, once in the morning, once at night, with the specific red light. And if I recall off the top of my head, it's around 650 nanometers of light. But I do want to mention for anybody listening, or if you're watching on YouTube, it's not just the wavelength. The wavelength is important, but the power density of the red light is really important. And so there's a lot of devices you can buy online for your at-home use, but power density might not be the amount you need. It might be too much. It might not be enough. And there are some publications looking into the risk of too much power density in causing potential photoretinal damage to the back of the eye if people are using red light therapies that are too high of power.
Is there a resource that you know of if someone's listening and they have a kid who's been diagnosed with myopia or perhaps themselves and they're thinking, I might like to get a red light, but I want to make sure I'm doing this correctly. So they're getting a device that's delivering the right intensity, the right wavelength. How would they kind of go about that?
So right now, if you're in the United States, unfortunately, you probably won't have access to anything. It's unfortunate, but there's also limitations. I've tried to get access to some of the publications, and there's like a government block on some of this research. I don't fully understand it. I can't say it's a government block, but somehow, since I'm in the US, they won't let me have it. So I don't know what's going on. But if you're outside of the United States, I would say go talk to your local eye doctor. They probably have more resources. They may have access to more resources. And right now, a lot of this red light technology is only available in clinical trials. So they may not be able to get it unless they sign up to be in one of these clinical trials.
And what do we need to know about contact lenses? I've been wearing them, since I was about 13. So a long time now. And through that time, I think I began that journey with monthlies. I then moved to dailies. I understand there's a whole lot of different types of contact lenses. How would you kind of encourage someone like me to be thinking about contact lenses in terms of the type that I'm choosing, how I would go about that, and also how often I'm wearing them, whether that matters?
All really good questions. It's funny because, again, you and I share this similar path of like we got contact lenses like when we were in junior high. I still wear contact lenses. I'm actually considering getting out of them at some point. So contact lenses have evolved over the last 30, 40 years. Soft contact lenses, if someone can go and if you're wearing like a 2-week replacement or a monthly replacement contact lens where you're cleaning them at nighttime, hopefully not sleeping in them. Sleeping in contact lenses is the number one risk factor for developing an ulcer, an infection. Those are always like some of our worst nightmares. Somebody comes in and they slept in their contact lenses and the next day their eye's in pain and it's red. And we see this massive ulcer. The most common infection with contact lenses in the eye is something, I don't want to go too much into it, but basically it can eat through the eye within 24 hours. And so those always end up with terrible scarring on the eye. It's painful. It can result in permanent vision loss. So number one thing, don't sleep in your contacts. Even if they've been designed to sleep in, unless your doctor has specifically prescribed a specific lens for you to sleep in, do not do it. Swimming in contact lenses, especially hot tubbing, do not do that. Again, the two worst infections you can get with contact lenses in the eye is either Pseudomonas, which is the one that can eat through the eye within 24 hours, and then acanthamoeba. And acanthamoeba you get classically from people swimming or going hot tubbing in contact lenses. And that type of infection is an amoeba that digs and eats through the eye. And
that's interesting because I think most people, myself included, would be experienced with closing your eyes when you're underwater and but obviously you're not completely eliminating the chance of water getting into your eye.
Yeah. So contact lenses obviously can give you a great vision and everything, but the surface of the eye, your tears, have antimicrobial properties in them. They have antiviral properties in them. You have a lot of electrolytes and proteins that are in your tears, more than just water. But the surface of your eye, when you're wearing a contact lens, it's still technically moving a little bit on the surface and can create small erosions. And those erosions means it's like scratching your skin. And so you have an open wound to the air or to the tears. And if there's bacteria that are overloading the system, they can get in through those, that breakdown of tissue, and then you can get these terrible infections. I'll say for people who are wearing 2-week or monthly contact lenses, switching to a single-use daily lens, They are a bit more expensive, but you don't have to pay for the solution to clean it. And not getting an infection also saves you the money of not having to come see me. All the fees to come see an eye doctor and then pay for medications in case you do get a complication or infection. The biggest risks otherwise with contact lenses is risk of dry eye, right? Contact lenses quickly accelerate the evaporation of the tear film on the surface of the eye. They cause a lot of instability. And so there are thankfully a lot of there's always new contact lenses in the research. It takes about a decade of research to develop a new contact lens. But when they finally get to market, these newer lenses are designed to prevent as much dryness as possible. So there are some consequences of contact lenses, but those are some of the bigger ones.
You said you're thinking of transitioning out of contact lens. If you don't mind me asking, is that to wear glasses kind of full time, or is it to kind of do some type of surgery to correct your vision?
Yeah, I am looking into a surgery to get correction. There's different types of refractive surgery, right? The LASIK is what people mostly know of. Then there's PRK, which is an older version, kind of like LASIK. There's a new version of LASIK called SMILE. And I can kind of break all these down if we want to go into it. And then there's another one, which is better for people with high prescriptions like you and I have. That's called an ICL, or an intracolumnar lens implant. And this is kind of like implanting a piece of plastic, like a contact lens, inside of the eye. And what's nice is that that type of procedure is reversible, where LASIK is not. Once you have LASIK, it's done. You can't go back. ICL is reversible, and you don't have to make as large of a cut on the surface of the eye as LASIK does. And so the corneal nerves are not severed, and you don't have as high a risk of dry eye complications. And that's one of my primary motivators to get out of contact lenses, is because I have suffered from dry eye for many years, and I have it pretty well under control right now. But the more I research, and I specialize more in anterior segment disease and dry eye, the more I research in that area, the more obvious it is to me that I want to get out of contact lenses, just to reduce my risk of getting worse dry eye in the future.
And if you go down that path of, was it ICL? ICL. Yep. So that's there some sort of lens implant.
Mm-hmm.
Are you still likely, like most adults, to develop? Is it presbyopia?
Correct.
Am I getting that right?
You got it.
Yeah. Are you still, even with that surgery, are you still likely to develop that later?
Unfortunately, yeah. You still carry that risk of presbyopia. You still carry the risk of cataracts. And then because I'm nearsighted, all of the potential risks of different eye diseases because of the elongation or the axial elongation of my eye, that's still there. But for me, having clear vision without having to rely on glasses and without having this increased risk of dry eye complications because of the contact lens on my eye, I'll probably get at least somewhere between 10 to 15 years worth of good, clear vision at all distances before I have to start thinking about reading glasses, multifocal contacts, and we also have different types of even medicated eye drops now to help with near vision correction, not having to just rely on reading glasses.
Is there such a thing as wearing contact lenses for too many hours across a day? Like, would you recommend a certain number of hours and then shifting to glasses? I've had certain optometrists tell me, yes, you should absolutely be doing that. And then I've had others, suggesting that maybe it doesn't matter.
So it does depend a little bit on the lens that you're wearing. Some contact lenses, so something that a lot of people don't know is that the eyeball, the surface of your eye, breathes oxygen. Your eyeball needs oxygen touching it. And it gets a lot of oxygen either directly from the air or because there's oxygen in your tear film. And so a long time ago, when contact lenses were first invented, they were made of a plastic that did not allow oxygen to flow through the plastic. And so the surface of the eye would start to become, they wouldn't have enough oxygen and it would become cloudy. It would become opaque white. You couldn't see through it anymore. And that's because of fluid dynamics that change in the eye. So newer contact lenses have higher amounts of oxygen transmissibility. They allow oxygen to flow through the plastic and through your tears to get into your eye. I think no matter what, if you're wearing a newer lens that has a higher oxygen transmissibility factor, which we call dK over T, then you're probably fine to wear for anywhere from 12 to 16 hours a day because there's a low risk of corneal hypoxia. The one factor that doesn't change depending, I'll say the one factor I would be concerned about if you're wearing it for long periods of the day is just your tear film. Because your tears are evaporating faster throughout the day, there's a buildup of inflammatory metabolites in your tear film, and that can contribute to discomfort and potentially kind of triggering true dry eye disease down the road.
If someone has noticed recently, it's getting more and more difficult to read things up close. Like we mentioned before, a book or a menu, and they're 40 or 50 years of age, so maybe they're starting to develop presbyopia. Is correcting that with glasses? So going to see an optometrist, figuring out where your vision's at, and then correcting that with glasses. Is that the most common kind of solution? Is surgery an option for this type of vision loss? You mentioned eye drops. Like what are the various options that someone in this position has?
So definitely one, seeing an eye doctor right away, just to get a thorough evaluation, make sure they know what's going on. Usually glasses, whether it be bifocals or progressives, which are the no-line bifocal. In Europe, they're called varifocals. So that's one of the easier options, I would say, for people to be fit in and have good vision.
And does a progressive set of glasses allows you to read that menu but still see a long distance, or it only allows you to read?
Yeah, so the progressive glasses are ones that you'd wear like all the time. It's where if you look at through the top of the lens, everything in the distance is clear. But then as you shift to look downward toward like your menu, then things are magnified at the bottom of the lens so that you can see clearly.
Oh, that's cool.
Again, in Europe, those are called varifocals. Some people don't like them because they can create some distortion. It's like a funhouse mirror a little bit at the bottom of the lens, trying to find where the perfect spot is. That frustrates some people. There are multifocal contact lenses. They're not for everybody, but for a lot of people, they can give freedom away from having to rely on progressives or reading glasses. There is an eye drop that's currently FDA approved and on the market for seeing better up close for presbyopia. And this medication causes constriction of your pupil. And this creates a pinhole effect so that your depth of field or your range of sharp vision is extended. And so this allows people to see better up close without diminishing their visual acuity in the distance. Some people with that, because their pupil gets smaller, their vision can dim. And so if they're in a dark room, or driving at nighttime, there's some people who've had trouble with that. And so that is an option, and there's new pharmaceuticals currently being developed to optimize that, so there's not as much side effects. And those are currently going through either phase 2 or phase 3 clinical trials, and we'll have them in the next year or next several years. So we might get to a point where you'll just be able to wake up, put in one eye drop, and then not need to worry about reading glasses or anything for the entire day. And you'll just do that every morning. And then as far as surgery, there have been some surgical corrections to try and correct for presbyopia with small implants in the surface of the eye. But they haven't been the most successful. And a lot of times they've just been kind of discontinued or fallen off the market just because they haven't had as much of a wow factor of like LASIK is. There is another option, a surgical option where, so if you have cataract surgery, right? If someone lives long enough, they can have cataracts and they have cataract surgery, there's various implants that can be put inside the eye. And those implants, some of them allow for multifocal. They allow you to see far away, intermediate for like your computer, and up close. And so that's kind of like getting LASIK, but it kind of gives you, it's not perfect. It doesn't allow you to see just like you did when you were 20, but it does give you those ranges back. And so some people will choose, they'll pay extra money because insurance won't cover it here in the United States, but some people will choose to have refractive lens exchange is what we call it, which is essentially getting cataract surgery before you have cataracts. And so they'll get that implant put in their 40s or 50s so that they don't ever really experience the development of cataracts, but then they also get this range of clear vision back. So that is an option.
What are the risks if you kind of go untreated? So you're in your 40s or 50s, it's starting to get hard to read things close up, but you ignore it, you don't go and see an optometrist, you kind of squint and strain your eyes a bit to read things, or you get someone else to read things for you. Are there, other than that being a real inconvenience to your life, just making life a little difficult, are there kind of long-term risks?
It's tough to say. I would say largely no. But again, more recent research looking at how our brain compensates for this, there can be a change in your visual processing speed. So if you choose to not correct your vision and not see optimally, your visual processing speed starts to decline. And that may have consequences on, like we mentioned earlier, higher risk of like dementia and like neurological changes down the road. So take home message, commit to a yearly eye exam. Get on top of these things early. Why do you not want to see like as good as you possibly can
Right.
in every scenario, right?
Yeah. Okay, cool. I think we save space for a part 2, and we can deep dive age-related macular degeneration, diabetic retinopathy. I have a bunch of questions about both of those and other things like floaters. But just before we finish, for this part 1, are there any major myths or misinformation, things maybe that we haven't touched on but are related to things we've spoken about that you see on social media about eye health that you'd like to kind of clear up in this episode before we wrap up?
Probably the biggest misinformation on the internet is that one about eye exercises. That's probably the one that frustrates me the most. But I know from just the clinical side of all the patients that we see that come into the eye clinic, there's so many people that let their vision go poor for years, right? The last time they came in to see an eye doctor was 7 or 10 years ago because they thought their vision was fine. And then they come in and it's too late. Like the disease that they have, we could have acted sooner 10 years ago and hopefully maybe had prevented them from losing permanent vision. But now they're at a spot where it's like, we can't do anything. So I just encourage everybody, even if you think your vision's perfect, you don't need glasses, you see fine, you don't need to see an eye doctor. Most medical insurances cover an annual eye exam now. So if you live in the US, use those benefits. Even if the doctor says, hey, everything looks great, awesome. But I would rather you go in and have a very healthy routine exam than go 7-10 years and then find out, oh crap, now you've got permanent vision loss.
And I'm sure it's helpful for you as an optometrist to kind of have these repeat measures. So if someone comes in and you can see that something's not right, you have a history of that person and kind of some idea as to how recent this change has occurred.
Absolutely. On top of that, you have a lot of parameters in the eye that you don't have feelings of, like eye pressure. If your eye pressure is elevated and you're at risk of glaucoma, you don't feel it. There's no pain.
Is that the test where they kind of like a puff of air hits your eye?
There is an older version or older way to test for eye pressure using a puff of air. Some clinics still use it. It's still valid, but it scares most people. Nobody likes it.
Right.
So there are some newer ways to test for it that are not only more accurate, but are less startling.
Mm-hmm.
But yeah, so getting your eye pressure checked is an important component of that. And then just having your eyes, your optic nerve and your retina evaluated. Well,
I'm due for my annual exam, so this has been a good reminder. Thank you very much, Dr. Allen. You're a wealth of knowledge. You have an incredible library of content, like I mentioned, on your YouTube channel. So we'll link to that in the show notes. Dr. Eye Health. Is there anywhere else that you'd like us to send people who want to connect with you?
Well, the number one way is, of course, on YouTube. Check out all the videos we posted on Dr. Eye Health. I am also on Instagram and TikTok. I probably, you won't catch me there as often as I am on YouTube. But those are the biggest places. Perfect.
Thank you again. It's been great. Thank you for taking the time to be with us today.
Thank you, Simon. This has been great.
There you have it, friends. I hope you enjoyed this episode. If you did and want to stay up to date with future episodes, be sure to hit that subscribe button on YouTube and follow on Apple or Spotify. Finally, thank you for showing up and the effort that you're making to take control of your health. I look forward to hanging out with you again in the next episode.